topics that we had in Boston that people requested are rotator cuff tears.
Yeah.
So outward or external rotations, what the rotator cuff does, but like we were saying, driving, typing is putting us here. And actually what leads to a lot of those inflammatory conditions or carpal tunnel or Raynaud's, where people's hands get really cold or they can turn white due to lack of circulation. It's amazing just how many functions and systems are affected by a rounded forward shoulder position.
No kidding.
And we were starting to say rotator cuff, so rotator cuff being an external rotator. So if anybody's ever reached up for something or just slept on their shoulder wrong, and then all of a sudden they have shoulder pain and they go to the doctor and say, you got a rotator cuff tear, a rotator cuff fraying. And like, how the heck did that even happen? Not like a baseball pitcher or anything. Like, how did I injure?
Yeah, right.
Yeah, it's just and the rotator cuff, if it externally rotates the arm this way, but your arm's hanging internal, because we've been doing this for all been in grade school, kind of, they're sleeping in class, like, just in this position. It's just those muscles get the training, if you will. The rotator gets pulled too long, and then it starts to fray, and then it loses. And eventually, as it gets pulled too long, it just starts to, fray and let go, and then can tear.
So what would you say to someone who has a rotator cuff tear? Is there a way that can naturally heal on its own?
Yeah, we've actually seen in the clinic degrees of tear. So usually it's grade 1, 2, and 3. Grade 1 is micro tears. Grade 2 is a more intense tearing, so partial tearing of the tendon. Grade 3 is a complete rupture. We've seen actually all in the clinic, and even with grade 3 ruptures, we've helped clients be able to get back to almost completely normal range of motion using other muscles that assist with the rotator cuff to compensate. Even grade 2, grade 1, if there's partial fraying or just fraying in general, damage, tendinitis, things like that, we can absolutely help, because it's all about returning the body to a position where it can heal. And if the shoulders constantly, like this,
not going to happen.
It's not going to heal. Just constantly getting pulled on. So
So I'm obviously I'm on board with improving the position so that it can heal. But then are the muscles, when you're at like a grade 3, are you basically able to strengthen the stabilizing mechanism, or are the muscles able to actually heal properly when you have a grade 3 rotator cuff tear?
Yeah, grade 3 is like complete tear of the tendons.
Right.
And typically supraspinatus, you have 4 rotator cuff muscles. The supraspinatus is the major one that we typically see is injured. If that's a complete rupture, then that muscle is not going to be able to pull or essentially move the shoulder, because there's no attaching it. But then you have the 3, other rotating cuff muscles. You have your
infraspinatus.
Infraspinatus.
Teres.
Subscapularis. Deltoid that assists with the rotator cuff. You have the muscle called your levator scapula, which helps us. All these muscles can assist with the function of the rotator cuff, and actually that is another mechanism that we can see if these other muscles become painful, is a result of those other muscles overcompensating for a under leveraged or a weak, if you will, rotator cuff. So you can still stabilize the shoulder. You can still improve its mechanism, even if one of those muscles is torn. Obviously, what they would do is they'd go and they'd take the muscle that's torn and they'd anchor it in place, so you would have that muscle able to work and leverage again. And people want to get that done, feel free, but there is other ways to improve the shoulder function if you're looking to get the body as properly aligned and functional as you can going into surgery for the best possible outcomes.
No kidding.
The
last thing you need is to anchor it down and you're still like this.
Well, that's the thing. Yeah, that's right. They go and they anchor the muscle in place, but they don't change the shoulder alignment. So essentially they're taking the rotator cuff, anchoring in place, but the shoulder can still stay rounded, which is still going to stress that muscle anyway. So fraying can happen down the line, or other stress on the rotator cuff, even after it's repaired, can happen if the shoulder position doesn't change.
Yeah. And sometimes, like, even when you're going to improve, not that we want to get too far in the weeds, but most of the time to even facilitate the repair of the rotator cuff and to facilitate an improved position of the rotator cuff, we go to the hips and pelvis first.
Yeah.
We've got to make sure we pull out the rotation first. So it's not just going to be the rotator cuff sequence, you know, as the only thing you do when you have a torn rotator cuff.
Oftentimes that's where we need to go first with clients, you know, with any shoulder, you know, shoulder pain or frozen shoulder or rotator cuff. Sometimes it stems from the hips, you know, and if the hips or the pelvis is off, think of that as the platform that your upper body sits on top of. So if that's off in any way, it's going to force the shoulders and upper back to deviate and operate in a misaligned position, which is going to put stress on it and lead to pain. So it's the hips, knees, and ankles, you know, those are the load bearing joints, like you said, play a shoulder, and they often need to first.
See, look at how simple that is.
About it.
Yeah.